far as radiology goes, in this edition of Back to Basics, I have added, all the modalities, all the knowledge is system-wise. Like you have a separate section on neuroimaging, orthopedic imaging, GI imaging, everything in one place, so that you have a ready access to your exam preparation, both for your professional exams as well as for your NEET PG exam. Plus, I have also added a section on radiological science, which I believe will be the game changer for the INICET paper, which is called as A to Z of Radiological Science.
So what is special in the new season of Back to Basics in Obs and Gynae videos? The first and the most important, you will now see that every topic has been dealt with separately, covering all the depth that you need, not only for your NEET PG, but also for your prof exams. Every topic is going to go from basic concepts with clinical, horizontal and vertical integration. We've used a lot more visual aids to make it more easy for you. So you will get lab images, gross images, histopathological images, hysteroscopic images, all at one place in the respective topics. These videos will cover all the updated guidelines that you would need for your upcoming exams. And especially now, we are going to come with new handwritten notes that are going to go along with these Back to Basics, complete notes that will be your study guide. So let's get ready for this new season of Back to Basics. Let's make learning more effective. Let's make learning a whole new experience.
Hello everyone. To all of you, I'm Dr. Tushar Mehta. I'm an orthopedic surgeon in Faculty of Orthopedics at DAMS. Well, in this year 2025, we are bringing to all of you a new edition, a new version of Back to Basics. This is the most crisp, concise, conceptual and comprehensive set of pre-recorded videos which are available pan-India. In these videos, not only you will have a workbook which is almost pre-written, but apart from that, with me, you will discuss all the clinical vignettes, anecdotes, patients in the form of the quintessential OPD next patient please. All these things are already written in your workbook, and the rest of the things will be dealt with all of you in the form of image-based questions. There are tables, there are line diagrams, there are flowcharts, there are examples, there are all the important lists that can help you in solving MCQs. Not only I will teach you these x-rays, but I will tell you the tallest, smallest, largest, shortest, most common, first common, last common, least, everything. We will cover entire subject in these videos in this new session 2025 in a very unique way, where you will not only understand the topic, the theory, but also the gist behind the topic with the most important thing, approach how to solve an MCQ. You need to understand that a multiple choice question is an objective representation of a subjective condition which has to be answered within a finite period of time. I will teach you the skill to do that after teaching you the entire subjective condition. I urge all of you to go through these all videos to find out what's best suitable for all of you and cover the entire syllabus in the most crisp way with me, that too belongs to orthopedics. So see you on the other side. God bless all of you.
Hi guys, still looking into the older videos in PSM? Pause, stop. Here comes the recent updated videos in Back to Basic in PSM, which is based on the recent workbook, a workbook which has been updated with recent data, recent facts, colored images and lots of questions. So do check out the recent videos and look into this workbook. PSM changes daily. You never know when the maternal mortality ratio can drop from 97 to 93 and to now 88. So guys, do not miss out on the updated version of Back to Basic. Your host, your dost, PSM said on the side. Take care.
Back to Basic, live recording, pharmacology. What is new in this edition? In each and every topic, I included the latest FDA approved drugs. Number two, each and every topic is concept-based learning. Not just knowing the drug name, you have to understand the concept of each drug mechanism, action, uses, adverse drug reaction. Complex topics were made very simple way with easy illustration and beautiful images. You can answer all type of image-based MCQs also. Comprehensive way of covering all the topic. If you understand every topic, you can answer any type of question from NEET PG or INICET PG examination. Moreover, it's a workbook-based teaching. You have the workbook, semi-fill the workbook given to you and see my videos and fill the topics. You can enjoy the topics, never get bored. I'm damn sure that it's going to make you very, very useful, going to increase your energy of preparing for PG examination. I'm super confident that you are whether beginner or you are going to revise this topic. These videos are definitely going to helpful for you. Thank you. All the very best. May God bless you by Dr. Thirunavukarasu.
Hi students, the new version of Back to Basics Pediatrics by me, Dr. Siddharth Sethi, is now live on eMedico's app. Now what is there new in the new workbook based teaching? So of course it's a workbook based teaching and you can see all the content will be right there in your workbook, which you can download, you can print. All the images are right there. So you can understand the whole case with the clinical context with all the images right there in the workbook with you. What I've done is, in addition, I have also added all the PYQs right there. So if you want to look at the question, the clinical context followed by PYQs, you can see them right there in your workbook. Isn't it exciting? In addition to this, remember that we have divided the lectures into essential lectures, high yield lectures, which you also need to know for your exams, and of course, not to mention the Cortex based AI, where you have timestamps for all the videos. You can make a summary of the lectures. I hope you find this initiative exciting. We are all excited for this. See you on the other side. Thank you.
Dear medicos, very good morning. Myself, Dr. Deepak, DAMS ENT faculty. We are coming with our new edition of Back to Basic B2B with dynamic sessions where we will be teaching you everything in a very conceptual way. Everything will be very concise in a conceptual way so that you people can revise properly. We will be coming to teach you with line diagrams. I will be taking my ENT session. I'll be teaching you to draw mind maps of the whole audiometry and all the important topics, must read topics. We'll be discussing all the important PYQs this year. In the session itself, we'll be adding last 3 years question bank where we will be discussing all the concepts which your NEET people or Central Institute examiner ask. Clear? We will be teaching you how to concise notes better. This is something a audiometry finding I am sharing on the slide, that is from neural deafness, and if you are able to revise the topic in 5 minutes, take my words, you're on the other side of the game. So the motive of these sessions is to only make you fast learner. So welcome for our new sessions, and I promise you better with these sessions you will get confidence, you will get ample time to revise. We'll be discussing all the new things which they have asked in the last NEET examination, and the success mantra for the NEET or Central Institute is here: we have to revise 4 times, and that will be possible only when we have our concise and crisp class notes. Best wishes.
Anji, hello everyone. So I'm Dr. Rajiv Tiwari, Surgery Faculty for DAMS. So as you know, we have come up with a new Back to Basic, and this lecture is quite different, not very but significantly different, in the sense some new MCQs are there that I've discussed, whatever recently has been asked, and some more minor topic I've included which was not there in the previous section, like lymphoma, endometrial malformation, and some minor topic also we have included. So definitely if you go through Back to Basic lecture, it covers, like my lecture covers complete GIT section, and you don't have to read any other book after this. You only have to watch the video and revise it. That will suffice. So all the best to all of you. I wish you all the best, and go for Back to Basic. That covers complete GIT section, hernia and bariatric, liver, gallbladder, pancreas and trauma. This is what I've discussed, and I can assure you this covers 100%, even more than what you need to know. All the best. Thank you.
Hello everyone. So in this B2B recording, I have tried to incorporate as many new facts as possible. We have gone back to the workbook model, so everything is on workbook now, it's not on PPT. I have included all the important images that will be necessary for your exams, and all the latest MCQs have been covered till date, till the time of recording of the P2B. So I really hope that all of you do very well, and I've tried to be very concise. I have tried to include all the explanations. It is more detailed this time, and I really hope you enjoy listening to that. Thank you so much, and all the best for your exams.
Yeah, hello guys. So new videos already recorded, back to basics, new videos with new pattern, workbook based videos. All the videos based on the new workbook, handwritten PDF of the workbook is already uploaded. Also latest CBME curriculum. So these videos are based on the latest curriculum by the CBME. Include all the topics. It includes latest topics, latest drugs in pharmacology. You will find each and every drug of pharmacology there, completely integrated with the clinical subjects, latest clinical topics, and the AI based Cortex, AI Cortex in the app eMedicos. They are enabled with it. You will get all the details in these videos. So watch these videos, download the eMedicos app. Thank you.
Hello dear students. We have recorded new lectures, new videos on back to basics in medicine. I have recorded endocrinology, gastroenterology, and good news for all of you that I have recorded hematology and oncology. So now in medicine you will get a new lectures, completely new lectures of hematology and oncology. So all diseases of hematology will be there. Then in endo, gastro, we are having new updates. So see that videos, and all these videos, they are workbook based. So semi printed workbook will be there, and PDF files are also uploaded on them. So let's see the videos and enjoy the videos, and all these videos are concept based. So definitely you are going to understand it. All the best.
Hi everyone, I'm Dr. Saurabh Sharma. So regarding DAMS Ophthalmology Workbook 2025, the special feature is that every main topic has been subdivided into various sections, and the videos which accompany them are in the same manner. They replicate the workbook. You have subsection videos of each and every major topic. Along with that, you get an annotated PDF which you can see in a split wise section in the eMedicos. At one portion you will get the videos, and the other portion you can have, if you want to see the notes, you can see the annotated PDF notes simultaneously. And now you have a Cortex AI generated timestamp. For those who want to see in the video which keyword you want to see, you can see according to the timestamp which is now generated by Cortex AI. And if you want to see, as I told you already, it's a subsection wise. So the main topic, for example, if you want to see retina anatomy, so go to the retina anatomy page in the workbook, and the same you can see replicate in the videos, so that you can see that video in a small effective manner, which is better for FMGE, INI-CET and NEET PG exam. I hope you learn well by watching the videos. Best wishes from my side.
Hi, my all dear students. This is your pediatrics faculty, Dr. Ashutosh Agarwal. We are coming up with a new version of Back to Basics. Now, again, what's new? Because the Nelson new edition is there, new editions we have made here. There are some modifications, the AIMS protocol of neonatology, we are here with you. So this contains all the essential materials, and I have divided the topics so that you will feel like you are just going through the printed notes. You can basically, this is workbook based teaching, and this will make the subject of pediatrics very, very easy for you. You have been always there. I have tried to include every topic from the basics, so that, for example, when I am explaining congenital heart diseases, I am starting with fetal circulation. I am explaining congenital hypothyroidism. I am starting from the basics of the thyroid hormone synthesis. So practically you will find that when you are studying, even if you don't are remembering the basics, I have done the basic part also and all the advanced part here also. And of course, don't remember to use our Cortex AI. That is something, a unique feature in our app, right? So all the best. Do watch the videos, and we are waiting for your reviews. Thanks.
the newer edition of Back to Basics psychiatry recorded videos are now live on eMedico's app. What's new in this? Number one, it is workbook based recording. So a semi printed workbook is there in which the remaining things are written, so it's easy to make notes. Number two, the Cortex AI enabled videos, where every video you will get a timestamp made up by AI so that you can navigate through the video. You can see the notes in the split screen feature, annotated PDF added. With the help of Cortex AI, you can get a summary of the lecture done. You can generate a predictive test. And these videos are recorded in two sections, that is the workbook section and the beyond workbook section. In the beyond workbook section, the latest update, the newer drug, amisulpride, eslicarbazepine, endoxifen, all the newer topics in community psychiatry have been separately recorded for the students looking for extra edge. All the best.
So hello friends, I'm Dr. Cheshta Agarwal, your dermatology educator. So there's a good news for all my NEET PG students that we have recently updated our Back to Basics and the dermatology course is already live. Now there are modifications done from the last year, the recent updates in leprosy, and there are little changes in the STD topics are done. There are many new topics has been added which is important for your exam. So I request all of you to please download the eMedico's app and get the benefit of these new videos in the Back to Basics for dermatology. Thank you all of you.
Hi, B2B, the recorded version of microbiology lectures, now available in our eMedico's app. What is special from the routine class? It is nothing but extended version of the routine class. If you want to learn some concept extra, use this Back to Basics. And end of each chapter, you have MCQs to titrate yourself immediately. It is based on NMC, competency-based medical education. We have included systems and infectious diseases. So hope you all enjoy this Back to Basics. Thank you.
Hello everyone, the updated medicine lectures are now live on the DAMS eMedico's app. Along with Cortex AI, these lectures, which are workbook based lectures, are available with a timestamp and a detailed summary of all the crisp points at end of each video. It can also generate a test based on the same video, helping you revise the topic in a quick and timely manner. These lectures are all integrated to make them clinically relevant so that at the end of medicine, you don't just become a good student of medicine, but also become a great doctor in medicine. All the very best to you.
Hello everyone. So here we are with the updated version of Back to Basics B2B videos. In this new updated version, you will find we have got concise, conceptual and clinically oriented anatomy lectures. This time we have AI Cortex, which is going to change the game for you guys. You can see whatever topic you want. You can just click on that topic and it will lead you to the videos. Along with that, it is a workbook based program. So the notes making will be very, very easily for you. So you just have to follow the video and side by side make the notes. And apart from that, we will provide you with the annotated PDF. So some topics are definitely from the workbook, and more than that, we have some extra edge topics also which we have covered for you guys. So definitely you are going to enjoy. This is a new, updated, and the style is also new as we have implemented the AI Cortex also we have incorporated into this. So overall, you are going to enjoy the learning B2B anatomy. Thank you so much.
Hello my dear students. Namaskar. I am Dr. Anshul Devakar and I am your faculty of anesthesia, and I welcome you to this wonderful new session of Back to Basics. This year I have tried to make a better workbook with better images, and the flow of the class is more streamlined. We have included a lot of things which are more important for our exams, like the topic on oxygen therapy and critical care, and the CPR, which is now embedded in between the class instead of being at the end of the class. And we have tried to make things very, very interesting, having a very clinical approach so that you not only gain the knowledge that you need in anesthesia, but are able to solve the most common questions that are asked in your exam. So I hope and I pray that you guys enjoy this session, this entire journey of Back to Basics 2025 with me. Thank you.
I am Dr. Sanjeev Chitragar, pathology faculty. So let me just brief you guys about the ideas of what changes have been made in Back to Basics recording of this year. One biggest change is the workbook based. So the workbook itself has become more interesting, more picturesque, and more following basically you, and also less writing for students. So you will be writing very little. So looking at this, so I'm just trying to show you one chapter of neoplasia here. You can see, so many things are already written, only few things you will have to be writing. So this is how the workbook is looking like. And let me just also try to show you hematology as well. The lot of diagrams like ray diagrams, flow charts, etc. are already pre-printed, so it has become more effective, more efficient way of learning. Then I have tried to concise it little bit more as compared to the previous Back to Basics. You have not lost, so there is no loss of any content, but it is more efficient, more better to remember, and I've included many more topics which have been asked and are of recent interest. So there have been additions in each one of them and few deletions here and there. You will end up knowing them. So let's just wait for this to be announced now. So we're going to have a beautiful section on general pathology, hematology, and systemic pathology by me, and all are workbook based for this year Back to Basics.
Hello everyone, I am Dr. Bharat Katti, Respiratory Medicine faculty. In this series, we are going to cover the anatomical and physiological aspects, the pulmonary function testing, clinical entities, respiratory diseases, acid-base balance, and most importantly, we will be doing clinical scenario-based MCQs and how to apply your knowledge in those questions, which is very important for NEET and INI-CET. And this year we have added something truly special: rapid revision summaries. These are concise, high impact summaries which are necessary for last minute revision. Our goal is to make you learn the concept, apply the concept in MCQs, and also revise then and there itself. Let's make this journey productive and enjoyable. Looking forward to be part of this learning experience.
Hi friends, this is Dr. Kashish Grover, your PSM faculty at DAMS, and I'm very excited to bring the new lectures for you on the app. As you know, PSM is a mixture of a dynamic and a static subject. Sampling, biostatistics, this is the static portion of PSM. But dynamic portions, the health program, the guidelines, the data, right? So the new series is both dynamic and static PSM ready. All the new updates, as you know, this year, the new textbook edition is also out. There are some changes in the tuberculosis guidelines. We have new regime for MDR, BPAL regime. There are some changes in the Niksha Poshan Yojana as well. Earlier it was 500 per month, but nowadays it's 1000 per month. So all of these changes, some changes are in vaccine also there. Earlier we used to say that use JE up to 15 years, but now the recent guideline says up to 2 years. With all the updates, we are here. And above all, these lectures are prof ready lectures, right? Sometimes you find it difficult how to write this question in exam. So these are basically prof ready lectures as well. I welcome you, right? I hope I would be able to make justice to your time. See you there. This is Dr. Kashish, your PSM faculty.
Hello, this is Dr. Achin Mehra. I'm faculty at DAMS. I've been particularly teaching neurology and endocrine for the last 15 years at DAMS. I got a lot of students and they used to tell me that they have a lot of difficulty in attending physical classes just because of the college constraints, or maybe the non-availability of the live classroom teaching in their own city. But we have got a remedy for this. We've got lectures recorded in a format of Back to Basics. You get the same quality and the content of the lectures that we cover in the live classroom teaching anywhere across the country. And the best part, all these lectures are synchronized into a simple workbook. So not less of a writing, maybe more of understanding at your end. Most important, in the recorded lectures, you are going to get the timestamp in which you can just scroll to that part which you want to revise and read again. And also we've got an AI advantage in form of Cortex AI, in which you can quickly revise the topic at your end by the Myra technology. Yes. So let's meet again in the lectures of Back to Basics. Thank you.
No one saves us but ourselves. No one can and no one may. We ourselves must walk the path.
So hi guys, it's time to walk the path with us, that is DAMS Alpha. Hi guys, I'm Dr. Gaurav Tehri, your pathology educator at DAMS. As we all know, now DAMS is Alpha. And what is Alpha in DAMS now? We have workbook based recording. We have started our back to base recording where you will get annotated PDFs, and the main USP is Cortex AI features. These Cortex AI features will summarize all the main text view and into main important points. And along with that, you can also give predictable future MCQs. So what are you waiting for? Let's join DAMS.
Hello everyone. Hi, this is Dr. Anil Mirchandani, your teacher in OBGY. Well, the new videos of Back to Basics are available now, and my videos would be there as well. And of course, this time what is new? This time we have Cortex AI, the artificial intelligence. You need a summary, it's available. You need, specific topic, you can go to the specific topic with the help of time frame. The timestamps are there to every video. And yes, this time it would be easy to revise, easy to remember type of workbook, and you will be filling up the workbook while watching videos. And yes, this will be helpful in your revision purpose as well. So guys, be ready. We have our new videos available, and we will be happily studying and learning the subject of obstetrics and gynecology. See you.
Hi everyone, my name is Dr. Arvind. I am very excited to announce the launch of new medicine lectures in DAMS Alpha N. These lectures are workbook based, means there will be lots of flowchart, filling the blanks, puzzles, quiz, images, and we will be discussing treatment algorithms, and we will apply those flowcharts into solving the tough medicine questions. So let's join and we will master this art of medicine in a smarter and faster way.
Hello everyone. So finally, the recent updated Back to Basics lectures are available in your DAMS Alpha app with Cortex AI enabled feature, which will help you in summarizing the entire lectures. And also AI will generate the timestamps of the lecture as well, so that it is easier for all of you to navigate through the lecture. So let's make the maximum use of this feature and learn your entire pathology with the help of all the latest updated workbooks in the most crisp, concise and conceptual manner.